Dear pelvic physiotherapist, my name is Sophie and I work at Novukar Pelvic Health BV. A warm welcome to this Maple Online Electrostimulation ES training. You can also visit our freely accessible YouTube channel where you'll find numerous training sessions, instructions, presentations, and webinars. However, today we will focus specifically on the ES capabilities of Maple. What is ES and how does the current run? ES stimulates muscle and nerve responses by applying electrical current. With Maple, we mainly work with the action potential in muscle fibers, depolarization and repolarization of sodium and potassium through the cell membrane. What does this mean? This relates to how nerve cells, neurons, transmit electrical signals. Depolarization. This occurs when sodium ions enter the cell through the cell membrane, making the inside of the cell more positive relative to the outside. This marks the beginning of an action potential, electrical impulse. Repolarization. After the cell becomes positive, potassium ions exit to restore the original negative charge inside. This helps return the cell to its resting state. In short, sodium enters, depolarization, potassium exits, repolarization, creating an electrical signal that travels through the nerves. While we cannot directly stimulate smooth muscle tissue, we can inhibit the bladder. Coordination between sensory input, motor function, and the brain plays a crucial role. Types of muscle fibers. There are 3 types of muscle fibers. 1. Slow twitch fibers, suitable for endurance with longer stimulation cycles. 2. Fast twitch fibers, suitable for explosive power with short and powerful cycles. 3. Intermediate fibers, a combination of both properties. Goals of ES. ES can be applied for various purposes: improving coordination, enhancing muscle control, stimulating contraction, targeting both slow and fast twitch fibers, detrusor inhibition, mainly for overactive bladder, no pain relief, using the gate control theory or endorphin release, tonus regulation, relaxing overactive muscles, increasing awareness, helping patients feel and control their pelvic floor muscles. Gate control theory. Pain can be relieved by applying a mild stimulus, activating A-beta fibers that inhibit pain signals in the spinal cord. This differs from endorphin release, which not only relieves pain but also promotes relaxation. Patient-centered approach. Always keep the patient at the center of treatment. Do not focus solely on iPad settings, but also observe breathing and possible compensations, such as tension in the gluteal muscles. Adjusting ES protocols. Adapt ES protocols based on specific goals. Fast twitch fibers, start at 70 to 80 Hz. Slow twitch fibers, start at 35 to 40 Hz. Experiment with phase duration and frequency to achieve optimal stimulation. Electrode size and placement. Larger electrodes, as used in older equipment, can handle higher amplitudes, activating more muscles. Maple uses smaller electrodes with different properties. Continuously evaluate and adjust settings to achieve optimal results. Tips for effective ES use. Try the settings on yourself to understand how they feel. Observations during stimulation. O slow fast twitch, a vibrating sensation. O thalamus stimulation, a pulsing sensation, avoid sharp pricking. O gate control, a strong pressure sensation on the pelvic floor. Pre-programmed ES settings, vaginal and anal. The app provides predefined settings for various dysfunctions, including underactivity, hypertonia, overactivity, hypertonia continuous, urgency, frequency, urge, urinary incontinence, OAB, overactive bladder, high and low frequency pain management. Possible reasons for ineffective ES. If ES does not produce a sensory response or muscle contraction, possible causes include too low current intensity, incorrect electrode placement, suboptimal stimulation settings, insufficient, excessive, or unsuitable conductive gel, underlying nerve damage. Adjusting electrode configuration. The first configuration is ring-ring. You select 2 rings, chosen from ring 1, 2, 3, 4, 5, and 6. The first selected ring is positive and the second is negative. The second configuration option is side-side. You select 2 sides, chosen from anterior, left, posterior, and right. The first selected side is positive and the second is negative. The third option is side 1, 1. Here you select 1 or 2 sides, chosen from anterior, left, posterior, and right. For each selected side, the first, third, and fifth electrodes are positive, while the second, fourth, and sixth electrodes are negative. The final configuration option is side 3. 3. You select two sides, anterior left, posterior right. For each side, the first, second, and third electrodes are positive, while the fourth, fifth, and sixth electrodes are negative. Halfway through the stimulation, the polarity reverses. Positive becomes negative, and negative becomes positive. If stimulation does not produce contraction, possible denervation, stimulate active areas to reach less active ones indirectly. Adjusting ES sensitivity. If ES feels too sharp, reduce phase duration and gradually increase it or raise frequency. If ES is not strongly felt, increase phase duration or adjust frequency. Practical advice. For patients with sensory or motor nerve damage, work around the affected area. Use the grid display to identify responsive areas. Electrostimulation restrictions. Do not use Maple ES in cases of suspected or confirmed colorectal or urogenital cancer, pregnancy, high fever, implanted electrical devices, for example, pacemakers. Modifying stimulation settings. 1. Select location, vaginal or anal. 2. Choose a preset, manufacturer presets, user-defined settings, or last used settings. 3. Adjust phase duration in increments of 10 microseconds. 4. Set pulse frequency in increments of 1 Hz. 5. Configure fade-in and fade-out times, adjust in 1 second increments. 6. Set hold time, adjustable in 1 second increments. 7. Set pause time, adjustable in 1 second increments. 8. Set number of cycles. 9. Select electrode configuration. Choose one of the 4 options: ring, side, side 1, 1, or side 3, 3. Finally, at the right top, activate stimulation. Safety precautions. Ensure correct placement of the Maple probe for proper tissue contact. Be aware that high current intensities can cause irritation. Above, we show it again in the line graph. At number 5, we set the fade-in/fade-out. At number 6, we display the hold time, which can be adjusted in steps of 1 second. Number 7 shows the pause time, which can also be adjusted in steps of 1 second. Number 8 indicates the total number of cycles. The Maple system is used for performing measurements and applying electrostimulation. Electrostimulation is limited to a maximum of 29 milliamperes. Performances exceeding this limit pose risks, as identified during risk management. Overstimulation can lead to unacceptable risks. To prevent this, appropriate safety measures have been integrated into both the hardware and software. These measures ensure that stimulation always remains within a safe and acceptable level. Since performances below the specified limit are not acceptable, the electrostimulation function of the Maple system is defined as an essential performance function. This means that stimulation must always remain within the prescribed maximum limit. Upcoming training sessions. Later this year, we will host a clinical reasoning training in collaboration with an experienced pelvic physiotherapist. We will discuss various cases, and you will have the opportunity to contribute and ask questions. Stay up to date by following us on YouTube, Facebook, Instagram, and LinkedIn for the latest training sessions, webinars, and information about the Maple Day on Thursday, October 16th in Bunnock. Have you already registered? If you have any questions following this training, feel free to contact us via email, WhatsApp, or phone. We are happy to assist you. Thank you, and see you next time.